for this objective, it's really looking at improving outcomes for children and adolescents. And the main piece of work within this objective was the implementation of the Specialist Paediatric and Adolescent Rehabilitation Service, or SPARS. And this is about ensuring that children with spinal cord injury have the opportunity to go to Starship Wilson Centre to undertake rehabilitation in an age-appropriate specialist service. And there was 83% of healthcare professionals that we surveyed agreed that the pathway had really supported health and wellbeing outcomes for children with spinal cord injury. And 92% of healthcare professionals felt that the children were supported to prepare for and participate in meaningful activities of their choice once they were discharged from the unit. And this was backed up by the interviews that we did with children, adolescents and their family, suggesting that there was a really high level of satisfaction with the services that they received at Starship Hospital and the Wilson Centre, and that health professionals were great at giving children and family members adequate levels of advice and information for when they were discharged. So in sort of from January 2014 to December 2018, there was 39 children who accessed SPARS, and most of those, 79% of those, were Ministry of Health, and 21% were funded by ACC, with a wide range of ages. It appears that it's a little bit difficult to tell, but at the moment we're not entirely sure that everybody is accessing the service. We're not sure whether that's because they're not being offered it or whether they're choosing not to access it. It appears that children with traumatic spinal cord injury who live in the North Island have a more seamless transition into SPARS. But those who have non-traumatic or incomplete spinal cord injury, it doesn't appear to be implemented quite as consistently. There was certainly some inequities between Ministry of Health and ACC funding highlighted within for children and adolescents with spinal cord injuries, and this fragmented services across the continuum of care, particularly for Ministry of Health funded children and adolescents, was highlighted as a key concern. From the parents' perspectives, having to navigate a multitude of specialists, paediatric specialists, but also spinal cord injury specialists and specialists, for instance, for musculoskeletal issues and neurological issues, etc., was quite problematic at times and took a lot of time and energy and made it quite difficult. So overall, our recommendations were that outreach and reassessment services needed to be relooked at, particularly how to best meet the needs of the person with spinal cord injury, the child and adolescent, but also the family, how these reviews could be timely, and making sure that the options were just that were explored were focused on the future and not just identifying what are the problems now. Equipment assessment is also an issue for this age group, particularly with a growing child, growing needs, and for those for Ministry of Health funding, often the assessments and the review of equipment needs weren't done in a timely fashion, and this was meaning that children were, for instance, getting cares beyond what was age appropriate for them, needing their parents to support them with cares. And there was also a need to continue to look in how children and adolescents could transition from child paediatric services into adult services and to be linked into those systems. There's been some work in that area, but we feel that it needs more work in implementing that consistently.